Hello, everybody. This is Gary. Today is Monday, March 20th, 2023. It is 5:09 p.m. Eastern Standard Time in the United States and Rochester, New York, and this is my coping with schizophrenia blog entry for today. Today, I'm not doing too bad. My anxiety levels are kind of high, but my paranoia, delusions, hallucinations, auditory hallucinations, depression are not that severe today. I just feel very anxious today. I did go out for my physical walking therapy exercises. I went to Walgreens to pick up some of my prescriptions. Um, I did some work on my computer. I do consumer surveys for extra money. And right now, I'm just doing this video as part of my daily schedule. Um, I have an appointment day after tomorrow with my peer support specialist. That's somebody who has a mental health diagnosis, who works on staff as a counselor at my clinic that I go to for mental health treatment. Next week, I have an appointment with my therapist, and then the first week of April, I have an appointment with my psychiatrist. I don't think we'll be changing any of my medications. Um, Today is the 20th, and on the 28th of March, I have an appointment with a pulmonary specialist, because I have pulmonary fibrosis in my lungs, and we have to decide how we're going to go about proceeding with this diagnosis, what kind of treatments, if any, that I will have. Um, there are several possible treatments. There's 2 medications approved for pulmonary fibrosis. Supplementary oxygen is a possible treatment because I get very short of breath. We don't know what's causing the pulmonary fibrosis. Pulmonary fibrosis is when scar tissue develops in the air sacs of the lungs, making it more difficult to breathe. So the pulmonary specialist will run a test to see how strong my lungs are. They may order more scans or biopsies. It's not cancer, but it is possible that the scar tissue could spread, making it progressively more difficult for me to breathe. And I don't know how bad it is right now because I haven't seen the pulmonary specialist yet. We have to run more tests. I haven't had a cigarette in 15 months. I don't think it was caused by smoking cigarettes. Um, the only thing I could think of that would irritate my lungs to cause the scarring is that I was using too much Clorox chlorine bleach to clean my apartment, and I was breathing in the fumes over the past 2 years. Not intentionally, of course. But I was using Clorox without diluting it with water to clean my apartment, like the kitchen and the bathroom. Um, so I will see the pulmonary specialist on March 28th, and we will go from there and see what happens. Everything else is going pretty much according to plan. There's nothing exciting going on, nothing much else to report on. My psychiatric symptoms are under good control today. It was kind of cold here in Rochester. It's March. It's northern United States. So it's kind of cold during the winter. Today was very sunny out. It wasn't snowing or raining, but it was cold. Um, and that always makes my physical pain worse. I had surgery in my right knee last year, and the cold weather makes the pain more pronounced. And it also makes my arthritis and joint pain more pronounced. I do take several medications for physical pain. I take the antidepressant Cymbalta for physical pain, Neurontin for physical pain, Tylenol for physical pain, and Motrin for physical pain, and Flexeril for lower back pain. It's a muscle relaxant. I already did my meditation twice today. I will do meditation later on. It helps with my anxiety, and it helps me sleep better, which in truth, insomnia has not been much of a problem over the past year. I have occasional insomnia, but it actually hasn't been that big a deal over the past year. So that's a good thing to report on. I'm more likely to end up in the psychiatric emergency room if I have insomnia for 3, 4, 5 days, because then my hallucinations, depression, paranoia, delusions, anxiety get worse if I can't sleep on a regular basis. Um, but that's all to report on now. Like, comment, share, subscribe.